Good afternoon, everyone. My name is Rudy Page, and welcome to our Community Wellness Dialogues. And I'm really pleased today we have Dr. Patricia Smith, and we will be talking about what your allied health professional can do for you. And one of the key elements of our Community Wellness Dialogues is to ensure our community is informed, reassured, so that they can make their choices. And we develop the health professionals trusted messenger model. And I'm really pleased today that we have Dr. Patricia Smith with us, who's a physiotherapist. So, Dr. Patricia Smith, good afternoon.
Good afternoon. Thank you very much for having me on your program.
We're really pleased that you've been able to attend. And the reason being is that what we say is the community is the workforce and the workforce is the community. Mm-hmm. And throughout this pandemic, we've ensured that there are no barriers between our communities and between the workforce, because building public trust and confidence is really important in terms of the health system. So, Patricia, tell us about your background and your professional journey.
Okay, well, I was born in the UK. I'm of Jamaican parentage, and I grew up in Jamaica from a very early age. My parents took myself and my siblings back to Jamaica, where we grew up. I attended high school there, St. Andrew High School for girls, and I went to University of the West Indies, where I did a first degree in natural sciences. And then I decided to move into health because I felt that I wanted to work with people. I was always what people would describe as a caring person. Mm-hmm. Even in my family, when members of my family became ill, I was always the one that was running to go make them a cup of tea or do something to help them.
Born to care, as we call it.
That's correct. So I was always like that. And I always felt that I wanted to work in a profession, in a health-related profession, where I could make a difference to people's lives. So that's what sort of brought me in terms of my journey into physiotherapy. But I can remember there was something quite striking. I remember when I was a young teenager, probably in my early teens, thinking about my career. I remember I was at home at the time, sitting under a mango tree. Yeah. And then I saw a young lady pass my gate where we lived in Mona Heights, and pass my gate, and she was in this green pair of trousers and white top, and she was walking really quickly to where she was going. And I used to see her pass several times, and I went, who is this person? What did she do? And I had the courage one day to stop, and she said she was a physiotherapy student. So physiotherapy, what's that? Never heard of that before. And then she explained to me what that was. And it sounded quite nice because she was talking about exercises, helping people to walk again, very hands-on. And that really attracted me a whole lot. And from then on, it was at the back of my mind as I went through my high school days and into my university days. I kind of diverted a little bit, but then came back to what I've now come to love and enjoy as my profession.
Okay, thanks for that. So can you describe the role of a physiotherapist and the type of training that is required?
Well, a physiotherapist has a very special role in the healthcare profession because we are the rehab people. We are the people that help to get people back into a functional state following an injury or following some sort of illness. And we are the people that are involved with movement, exercise, mobility, and doing various things to help people to get back to a level of function and independence, and we're very hands-on. We use physical agents as well. So there's a wide range of things that we do in physical therapy, or sometimes called physiotherapy, that we do in order to help somebody to get back to a level of independence, function, and to do the things that they couldn't do because of their injury. A lot of people know that people who've had a stroke and are unable to walk because of weakness on one side, they go to a physiotherapist, and we go through certain exercises in a particular way to facilitate muscle strength, muscle movement, tone, correct tone, and so forth, so that they can walk again. Somebody fractures their knee or their hip or their thigh or somewhere and they're unable to walk, then we go through a process in collaboration with our doctors, the nurses, and other members of the healthcare team to enable them to be able to get up and function again. And what we find is that it's not just about the physical exercises and the physical agents that we use, such as ultrasound, electrostimulations, and so forth, and certain hands-on techniques, but it's also about the relationship that we develop with the patient or the client. We develop such a good rapport because communication and that professional relationship with our patients is what helps us to have good outcomes in our interventions. It helps us to motivate, because you've got to motivate and engage the patient and stimulate them to want to engage in the exercises. So that relationship is very, very important, amongst other things.
Right. And as you say that, we think of self-care practice for life. So what does that mean to you when you're advising your clients and patients, and even speaking on public platforms?
Yeah, well, self-care is very important because a lot of people are just needs guidance or help on how to help themselves. And the more people are able to do for themselves, the better they are, because then they take ownership of their condition. They take ownership of the illness. When I say take ownership, they take ownership of overcoming it and being able to get back into a functional state. So self-care is important because a large part of what we do as physiotherapists as well is education. We educate the patient not only in how to walk, how to lift their leg, how to move, but how to take care of things in a way that supports themselves. So self-care is important because then it means that they will rely less on the professional. They'll rely less on the healthcare system. They are self-directed, self-motivated, and they determine the goals and where they want to go for themselves. And as physical therapists, we facilitate that, we support that, and we guide them through those processes.
Yeah, that's very interesting. So that kind of brings me to kind of a follow-up question on that. So obviously, and you touched on it earlier on, it's also to do with how people feel in terms of their mental well-being. So how do you sort of help people bring their confidence back? And what kind of confidence building measures do you
Well,
use?
that's a very important question because physiotherapists also, although we are sort of medically trained in a sense of we do medical sciences, we do orthopedic, neurological training and so forth. So we've got to know the physiology and anatomy of the body. We do all of that, and that's important. But because we're working with patients, and it's not just that the medical model approach, but because we're working with people, we have to understand the mental and emotional and environmental factors that can impact on a person's health and well-being. So we use a sort of systems approach as well, which is quite holistic and sort of biopsychosocial in its approach. So we look at the biological system, we look at the psychological system, their mind, their attitudes, their behaviors, their beliefs, and so forth, and social in terms of the families, the environment in which they live, the economic system, what's happening in the world and how that impacts on them. So stress is something that a lot of our patients undergo, and it affects the physical body as well. So in coming back to your question, we help, we try to help the patient though in that way by developing a good relationship, developing trust, helping the patient to be confident in what we're doing, being so that there's a lot of there's an issue of confidentiality, trust, respect, and accepting the patient where they are, and encouraging the patient, motivating them so that they can that they take ownership for their exercise and they want to do it for themselves.
Okay, thanks for that. And so, what has been your role during the pandemic?
Well, I even talked before the pandemic because my role existed before the pandemic.
Oh.
So, well, I am a lecturer. That's the first thing. I teach physical therapy, and I also teach in public health as well, and input on some nursing modules as well. So I'm quite interdisciplinary in terms of my my academic work, and also in terms of any clinical work that I do. But so before the pandemic, I've been very, very involved with community work, because I work a lot in the community, both in my church, and also in my in just voluntary groups in the community. So I was involved with doing working on with libraries in Newham. And I used to do, and still do, health workshops and seminars on musculoskeletal problems like back pain, knee pain, neck pain, and so forth, and how to help yourself with dealing with these pains. And that was for carers, and also for office workers, seating problems in the office and at home and so forth. So I did a lot of that. And I also worked very closely with diabetics in the community. So people who have long-term chronic conditions, such as metabolic conditions, such as diabetes. I used to do seminars, workshops at the libraries in Newham, particularly Manor Park Library, where patients, I would go through an educational talk on diabetes, what it was or what it is, and the exercises and lifestyle changes, things that you need to do to help yourself to live with the condition, to overcome the condition, to be independent and so forth, and to maintain a good quality of life. So I was very, very involved with that for a number of years in the community. During the pandemic, when I wasn't able to do that face-to-face, physically, I did a lot of online Zoom sessions with people, clients, patients, and so forth. This is all voluntary. And that was very, very good, because during the pandemic, people felt isolated. People felt as if they were out of touch with the health system. People were concerned, they were worried, they were anxious, they didn't know what to do. They couldn't move around as much as they would have wanted to. So those online Zoom sessions were quite timely for that group of people. And it worked quite well. They felt as if there was somebody that cared. They felt as if they knew what to do. They were given guidelines, they were given support. And it was also very interactive, because they could see their friends online, and there was a social element to it as well, which is good for the mental health and well-being. So.
Great. So that's really good that you were able to make the platform, and it's been really informative. And so we certainly look forward to meeting you again in the future.
Thank you.
And I would just like to thank you for joining us on this Community Wellness Dialogue. So that's Dr. Patricia Smith, physiotherapist, part of the allied health professional workforce. And again, as we always say, workforce is the community, community is the workforce. So thank you very much for being a trusted messenger, Patricia, and you take care of yourself. Thank you.
Thank you very much, Rudy, for having me.
Thank you.
Bye-bye.